Gauteng Premier Panyaza Lesufi will release provincial forensic audit unit investigation reports today. Now, last month, the Premier released 47 reports, which are part of 177 investigations. The first batch of reports revealed that at least 3.4 million rand was lost due to financial misconduct, with only 60% of that sum recovered and 55 criminal cases opened. Lesufi also revealed findings about officials' lifestyle audits, with 3 of 4 heads of departments failing the audits and ultimately being dismissed. Now, let's speak to the chairperson of the Gauteng Care Crisis Committee, Lisa Vetten. Dr Lisa Vetten, thank you so much for your time and for joining us this morning. So last month, the Premier announced that release of 47 reports out of the 177 investigations. What's your assessment of this progress so far?
Well, firstly, the release is very delayed. Some of these reports, and those specific to the Department of Social Development, date back to 2018. So it's 7 years later. And in many instances, certainly within the case of DSD, the officials implicated have already left. So the reports have been released a little too late in some instances, but it is important that they be released so that we understand what happened.
And speaking of that understanding, I mean, the release of these forensic investigations are quite important, do you think, for accountability and transparency, especially in the Gauteng province?
Yes, that is extremely important. I think one of the things that these reports do point to is weaknesses and loopholes in systems. So if those haven't yet been addressed, and I'd be very concerned if they hadn't yet been addressed, then now is the opportunity to see where do those weaknesses lie. I am hoping that he will also be talking about future and current or very recent problems within the Department of Social Development as well, because we don't just need to know about problems from a couple of years ago. We need to know about problems that occurred as recently as last year, because again, we need to keep pace with the evolution of, I think, of how people manipulate and rework systems in ways that suit them and allow for corruption and other malfeasance to take place. I mean, this is unfortunately something where you have to keep a constant eye because it is constantly evolving.
And the impact thereof is quite important currently. I mean, you do speak of previous cases. We already know that, 12 department officials have already been implicated, and this is specific to the health and social development. I mean, you mentioned DSD. What has been the impact on the funding of NPOs?
Well, that's been very, very difficult. I think we've seen, because I have had access to those reports, they were starting to circulate. It shows how I think that there were officials who were perhaps sometimes using organizations as conduits or directing them on who to use as suppliers, for example. So that funding was being used to sometimes enrich people who were connected to the department or who had links to others instead of going towards the provision of services. And also what it was doing was it was drawing NGOs into very undesirable schemes, which they were finding, I think, difficult to say no to because they were being told by the department to do this. So that is not good either, that some of them got drawn into this wrongdoing. I think the real problem with corruption is the significant way it siphons funds away from those who need them. Now, last year, and I'm not sure this has been, we don't know what has happened to this investigation, but at the beginning of last year, it was alleged that some 250 million had been misused in terms of supply chain management, again, in exactly the same set of programs that are the focus of these current 8 reports. Now, that report does not appear to have been completed. And it's concerned because it's the same program that was identified as a problem 8 years ago, reappearing with the same mechanisms. So again, it doesn't look like the necessary steps were taken, but it also means that some 250 million was taken out of the pot for NGOs. And when you add it to the department's further underspending of 220 million to NPO services last year, then you can see that we're heading towards R500 million, having been taken away from services to people in the province.
And R500 million that has led to the closure of many of these NPOs and, of course, many jobs that have been lost.
Yes, you can actually see this in the quarterly labour force surveys. The community and social services sector is probably one of the biggest sectors in the country for employment, and it employs a significant number of women, more than double the number of men. So anything that affects jobs in the circumstances has a deeply gendered and unequal effect. So we really have to look at protecting them, given the number of people that they employ.
Three officials, in fact, senior officials, have already now been dismissed, and this is due to the lifestyle audits that had been conducted. How do you think these reports influence public trust and confidence, especially in provincial governance?
There is a lot of skepticism, I think, particularly in relation to the Department of Health. And I think after the last couple of years in the Department of Social Development as well. So removements do help. I mean, I think, although I don't think he was dismissed, but certainly the acting head of social development has also been moved in this reshuffle out of social development. So I think that potentially opens up the way for fresh blood, new systems, hopefully the recalibration of relationships. But again, you know, these shuffles can sometimes simply look like rearranging deck chairs. You want to see the practice changing. You want to see a reduction in bad audit outcomes. In the case of the Department of Health, you want to see all the hospitals in the province passing health and safety inspections, which apparently none of them currently do. So that's really, I think, where the test of new leadership will be, is in correcting those serious deficiencies that place people's lives at risk.
So we mentioned earlier that already 47 out of the 177 reports have been released. What are your expectations regarding now the pace and the scope of the future release of these reports?
Well, I think one hopes they will go up onto a website so that everybody has access to them, because that increases transparency and accountability. One hopes that the portfolio committees responsible for these departments will also call meetings with the departments in order to find out what they are doing to rectify these serious shortcomings, because they are a very crucial body of oversight. And then I think one would want to hear where there is the scope for criminal charges, if these have been laid. If there isn't, then have the necessary disciplinary proceedings been implicated? And I think also where people's names have been tarnished. If these reports don't support the allegations against them, then there needs to be some kind of public recognition that harm has been done to them as well, so that they too can get on with their lives.